Hello, my name is Brian Pearson. I'm a student at William Carey, currently enrolled in the master's program. Today I will be doing a video presentation. My video presentation will consist of me demonstrating the clinical skill of a basic physical assessment. During my video presentation, I will showcase three learning strategies, teaching strategies. Those three strategies include visual aid, hands-on, and handouts. The handout is for the students to keep them actively engaged. The handout is for the students to fill out and follow along as we go through the PowerPoint and the physical examination. So let's get started. Getting started. First, I would wash my hands and introduce myself to the patient. Hello, my name is Brian Pierce. I'll be your nurse today. And after I've done these, I will start by assessing the patient's orientation. To assess the patient's orientation, you will ask them just general common knowledge questions such as their name, their date of birth, and the current president that's currently enrolled. After I've assessed their orientation, I will move on to getting their vital signs. Vital signs include getting their blood pressure, their O2 saturation, their respiratory rate, their pulse rate, and also assessing their level of pain. As you're getting their blood pressure, explain to the patient that they will feel a little tightness in their arm as you inflate the blood pressure cuff. (108/70). Next, we'll move on to getting the temperature, the pulse, and the pulse of the patient. Ask the patient to say "ah" and stick the thermometer under their tongue. If they aren't able to do that, you can get an axillary pulse by sticking the thermometer under their axillary, under their arm. Her O2 saturation is 96%. A good range for that we want the O2 saturation is between 90 and 100. Next, I'll assess the pulse. Temperature is 98. All right, your pulse was 78 beats per minute. For the pulse, you want the range to be between, a good pulse is between 60 and 100. And I also got her respirations while I was counting her pulse. It's good not to tell the patient that you're getting their respirations because they could change up their breathing pattern on you. Her respirations was 16 breaths per minute. The normal rate for respirations are between 12 and 20. Next, we will move on to assessing the head and the neck area. You want to look at the face and make sure everything is symmetric, which hers is. Her eyes, her ears, her lips, her nose, and they're good. Next, we'll move on to assessing the scalp. When you're assessing the head and scalp, you want to check for any sores or lesions. The condition of the hair. Her hair is in good condition. She's well groomed. Any pain or tenderness in the scalp. Next, we want to move on to the eyes. Are there any drainage or are they red? Any problems with your eyes? Next, we'll move on to assess the reaction of the pupils. When assessing the reaction of the pupils, we want to see if the pupils react sluggishly, briskly. This can tell you if there's any problems neurologically or if there's been any drug use. Next, we want to move on to the ears. Any pain or tenderness in the ears. You can ask the patient, are there any pain or tenderness in the ears? Any hearing problems? And you want to look inside the ears for sores or lesions. No drainage, no sores or lesions. Next, we want to assess the nose. Any drainage in the nose, no drainage. All right, next we want to assess the mouth. Any sores or lesions in the mouth. The hydration of the mouth. The teeth, are the teeth in good condition? Good oral hygiene. Good deal. Next, we'll move down to the neck. Assess the carotid artery. Do one at a time. So you want to include any blood flow to the brain. And next you want to assess the trach line. Is it deviated? Is it straight? Is it midline? And hers is midline. Alright, any sores or lesions on the neck? No. Skin turgor is good. Next we'll move on to the chest with a focus on the cardiovascular system. When assessing the chest, you want to look at the skin area for any sores or lesions, none noted. Check her skin turgor on the chest. There's no tendon, that's good hydration. You want to focus on 5 main points. And a way to remember those points are the acronym, all pigs eat too much. The first space is on the second intercostal space on the right side. And that A stands for aortic. You want to listen for any murmurs, any abnormal heartbeats, any arrhythmias, which I don't hear any. The next space is the pulmonic, which is on the second intercostal space on the left side. The third space is the Erb's point, which is in the third intercostal space on the left side. Okay. The fourth space is the tricuspid, which is in the fourth intercostal space on the left side. And the fifth place is the mitral valve, which is on the fifth intercostal space on the left side. All right, they all sound good. Next, we want to continue to focus on the chest, but this time on the respiratory system. When assessing the respiratory system on the chest, you want to go from left to right to compare side from side. And you want to listen to the breath sounds. You want to listen for any abnormal breath sounds that may be found. So we'll start on the left side. And the picture on the handout shows a good diagram of how to assess the respiratory system on the chest. Ask the patient to take a deep breath. Now we'll move on to the back and continue to assess the respiratory system on the back. Again, while you're assessing the respiratory system, you can get a good look at her skin for any sores or lesions on her back or any trauma to her back. And just continue to ask the patient to take a deep breath and compare side to side. After we've assessed the respiratory system, we'll move on to the abdomen. Now with the abdomen, before you palpate, you want to inspect, and then you want to auscultate. The reason why you want to do this is that if you palpate before you listen, you can disrupt the gastric movement inside the stomach. So first you want to inspect for any protrusions, any lumps, any masses, any sores or lesions, which none are noted. This is also a good time to get a good history of the patient's bowel movement. When was the last time they had a bowel movement? Do they take anything at home to help them have a bowel movement, and the consistency of the type of bowel movement that they have? You want to start in the upper right quadrant and go around like a clock. When assessing for bowel movement, for bowel sounds, you want to listen for gurgling noises. The abdomen is broken down into 4 quadrants: the upper right quadrant, the upper left quadrant, the lower left quadrant, and the lower right quadrant. And that's the way you document what you hear in each quadrant. If you don't hear bowel sounds in a certain quadrant, you need to give that quadrant a listen for a full 5 minutes before you say that no bowel sounds were heard in that quadrant. All right, after you've listened, tell the patient that you will palpate, that you want to palpate and feel for any masses or lesions. Ask the patient, are they feeling any tenderness once you palpate, and also pay attention to facial grimaces. Sometimes you may have a patient that is nonverbal, so you really need to pay attention to facial features and facial grimaces and non-verbal movement on them. All right, and once you do you start with a light palpation, and then you go into a deep palpation. No masses, no tenderness. No tenderness noted. All right, and that's good. So next we'll move on to the upper extremities. The upper extremities, you need to assess the temperature, assess the skin turgor, and good. And you can start and assess the pulses. You can start with the brachial pulses, and these you can do 2 at a time. When documenting about the pulses, we use the system, the 1 to 4 system, with 1 being a weak pulse and 4 being a strong pulse. And these are 2 plus. Next, we'll move on to the radial, and they're 2 plus. Next, we want to assess the nail beds and look at the cap refill. We want the cap refills to be less than 3 seconds, and what that is you mash down on the nail blade bed, and you want the color to return in less than 3 seconds. That's good. And that's good. And that shows good cardiovascular function. And next we'll demonstrate the grip. Make sure that the hand grip is strong, strong and equal in both hands. And they are. Next we'll assess the range of motion. You ask the patient to bend, flex, go in, go out. And if the patient can do it on their own, you let them do it on their own. If not, you do it manually. You listen for any cracks. Are there any pain noted upon any movement? So next, we'll move down to the lower extremities. With the legs, you do the same with the arm. You get the temperature, assess the skin for any sores, lesions, anything like that. None noted. And you want to assess the pulses on the legs, and we will grade them on the 1 to 4 scale as we did the upper extremities. First, we'll start with the popliteal pulse. Next, we'll move down to the dorsal pedal. Next, we'll move to the posterior tibial. Those are good. And we will assess all of those are 2 plus. The cap refill is good on their left foot. Cap refill is good on her right foot. All right, next we'll assess the range of motion of her legs. Like I said, ask her to bend and stretch in and out on each leg. Listen for any crackles. Ask the patient, are they in any pain on movement? And ask if they have any trouble walking, any history of pain with walking or anything. After you've got all your findings, communicate with your patient if you found anything abnormal, and tell them about the plan of care you wish to implement. Keep them in the loop so that they will be better involved with their plan of care.